what are you seeing AI for dentists, especially wellness dentists like us? Is what is going to help us in terms of treating patients, efficiency, time, and also knowledge, because there's so much out there.
Obviously, we have all the digital scanners to get scans of the teeth. We have these extraoral scanners to scan the face. We have the cone beams with things like DiagnoCat that can read the cone beam and see things better than any of us can. But you could probably have it read also your medical and dental history and all the 2D images as well, symptoms, problems, anything the patient has. It could probably basically give you just a treatment plan at that point with a full diagnosis. That's probably where it's going to end up at some point.
Hi, welcome to the Wellness Dentist Podcast. I have a special guest for you today, Dr. Brandon Breyer, a dentist who will be redefining what it means to build a startup practice, build a family, build a life that actually sustains you. His path into wellness dentistry didn't come from a textbook. It came from noticing that traditional model wasn't supporting the kind of health he wanted for himself, his patient, or his family. And so we're going to talk about the moment that he realized dentistry have not been practiced differently if he want longevity, not just production, not just number. We're going to dig into how wellness principle reshaped his philosophy and how fatherhood forced him to rethink his priorities and how he's building a business designed around purpose instead of burnout. Welcome, Brandon.
Thank you. Good to talk to you as always. Appreciate it.
Yes. So I know we have a lot of dentists, patients, medical provider, very curious about everyone's journey. Like, this is not how dental school trained us. And so how you get into this wellness journey, can you share with our audience?
Yeah, I guess just to kind of go back to, like you said, dental school, learning things that at the time are new to you, but as you get out and practice and take CE courses and start to learn some of the newer research and things like that, you just realize that what you learned in dental school was really just the bare minimum. And actually, a lot of the philosophies of treatment are, let's say, decades old. I was doing pin amalgam buildups and all kinds of these old practices, let's say, that you don't really see anymore in modern practice. So trending forward, I just took a lot of CE, and over the last 5 years, I've become well-rounded now in all kinds of restorative things, cosmetics, of course, and I took a lot of business CE because that's another thing you don't learn in dental school. So looking for mentors that have done what I've done. I used a lot of coaches in the past as well. I try to identify people that are doing things that I want to be doing. And ultimately, through recognizing a problem with the patient experience in my first job and the employee's experience, but yet successfully performing financially for 12 months as an associate on my own in the single practice that was more a regional DSO, let's say. That reflection point after that 12 months just told me that I could do better than this on my own. I immediately started looking for practices to buy. There wasn't a lot out there that piqued my interest. I wasn't going to buy a really old space or anything that needed a lot of rehab. I would have bought something that was more updated and modernized, let's say. But I ultimately just went on the startup path after I started listening to Dr. Ashley Hovez, and her journey really opened my eyes to the possibility of doing a startup, which I'd never even heard of before in dentistry, to be honest. So through her and knowing her for a few years and going through our retreats with the startup crew and meeting you, coming to your first course, which I did, the composite injection mold composite veneer, and learning more about some of your offerings and leaning into the wellness, which you are obviously a big part of in dentistry right now, is this new wave of wellness dentistry. And it kind of coincided with me coming across the current insurance model that actually parallels what we're going through at dentistry exactly. The insurance model, insurance dictated treatment, treat decay with fillings, treat perio with scaling and root planing, and then having this mindset or realization, let's say, that you are actually treating the end stage of disease, not doing anything to prevent it in the first place, but they're all connected to the mouth, at least in some way, right? But even people like Huberman, even though I've heard some podcasts that he's done regarding oral health and things like that, it is a little bit brushed over still, the oral health part. So that's where, we come in. A lot of what I've done to this point is just built out of frustration, honestly, with the current model of dentistry from a patient experience, employee experience standpoint, and then the clinical side of how we deliver care.
Wow. You listen to a lot of podcasts.
I did.
Yeah.
I got burnt out after a while, but yes, there was a lot of podcasts
Like,
listening.
a lot of patient asking, like, how do you learn when you're working so much and you have family? And, we learn how other people learn too by, of course, attending CE,
Yeah.
but we also learn by reading and listen to a lot of these educating podcasts to learn about how the medical world seeing patients or what changing, because like you said earlier, what changing in medicines are actually got happening in dentistries, now or very soon. So what I notice is you always looking for a way to improve how things work, right? When from
Yes.
associateship to the startup and then now the ownership with expansions and associate, what is the main force that driving you for always looking for that improvement? Was it something that you need to prove? Was it something that you always know that I have more potential than what I have now? Is that someone looking up to you? You feel the responsibility that, hey, I need to helping a lot of people that coming up and looking up at me and I want to show them the way. What is it that driving you the force? Because a lot of people want to know.
Yeah. It's that's probably a really difficult question to give like a single answer to. So I would probably look at it from a few different aspects. One, just instinctually, my personality. I'm always wanting to be busy. I can't sit still. I'm always wanting to feel like I'm growing and progressing. So I did really well in school because of that drive. But once I got out of school and started practicing and like mastered fillings and crowns and things like that, and the workflows, like if that's all you stick with for the rest of your career, that's a fast track to burnout. So I'm always looking for different ways to optimize care, optimize the patient experience, optimize our systems and protocols. And yes, my mind does work that way all the time. Leadership has been difficult in realizing that not everybody operates like me. So sometimes I have some good people here now, some of my leaders in the group that can let me know, okay, I need you to slow down for everybody else for the moment. We need to adopt this fully before we, jump into the next thing. So I've definitely been guilty of that to a sense. The second part of that answer to me is just exposing myself to a network of people. You never know who you're going to meet, whether you go to a study club or CE or even listen to podcasts. And don't be afraid to reach out to the host or the guest. More than that, people have always been willing to support me in any way, answer any questions that I have. Once I've exposed myself to these high achievers that I want to be in the same room as, they've lifted me up to the next level. And it's just, I feel like it's just constantly climbing a ladder that never ends.
Wow, that's beautiful. I love that you credit yourself to like, hey, I always want to stay busy and I always want to learn. But then you also notice that the network that you're surrounded, because a lot of dentists they feel like they they want to do more, but they're in the wrong room. Right, they're the
Mhm.
smartest one in the room, or they want the one that worked the hardest, and everyone else to kinda take it easy or to accept dentistry as bread and butter or drill and fill and bill model. So, I met your team, you have an impressive team. Guys, if you haven't met Brendan and his team, he may be like, "Oh, yeah, it's my team," but no, he built an impressive team. They speak really highly of him, and for me, in order to know a leader I love to talk to their people because
Yeah.
when you talk to their people, like you actually know, like do they respect their leader, do they love their leader. So share with us, what is your leadership style? How do you get your people to love you so dearly, support your
Mhm.
vision, like so hungry for like, I want to help him to achieve that vision? Like, how do you get them to do what they're doing for you every day?
So crazy to think about it because when we started, I started with one single employee, and now we're kind of in the range of like 16 or so, and then add on top of that a couple associates now. So I would say the biggest factor to maybe getting buy-in from the team, one is that I'm just myself. I'm very authentic, and I think that is obvious for people that are around you, and people can really pick up if you're not authentic. A lot of other dentists in the past or stories you might hear from employees and how the dentist was very selfish or very angry, throwing these things behind their back and maybe doing well, not giving them raises, but buying their boats and not fancy cars and things like that. I mean, my team knows me very well because of my authenticity. We're all pretty close in age range as well. So we got to know each other pretty well outside of the practice, just hanging out different times. And they see how I live, I guess is the basic idea. They know I'm not a fancy lifestyle guy and I exude the authenticity and the purpose that I have for what I'm doing. I share that with them. I have the vision and people can really attach to a vision and a purpose. A lot of the way I lead is built off of the principles from Simon Sinek. Honestly, when I was doing my startup, I read his Start with Why book. So I spent so much time to develop a simple vision statement to start with why, then the how, then the what. And on top of that, he had another book that followed that, Leaders Eat Last. So taking care of the team first. If my team needs something from me, I'm always giving, always giving. My hygienists break their loops. This happened recently, a couple of them in the past year or so. And I just have the rep come in, we buy them. I don't make them sign these contracts for taking them to CE or anything like that, which, yeah, could it bite you in the butt? Sure. But I'm a risk taker. And I think people that are really successful take risks, and the people that are kind of not achieving what they want are the ones that are typically afraid to take those risks.
Yeah. I love that the leadership style is role modeling. Like they're watching you live your life. They're watching you and practicing what you say you're practicing. And that's where the respect and the trust coming from. That the same for patient, right? They know that, hey, this is what you believe in, this is what you design, and then this is what you want for them. And that's exactly what
Yeah.
you believe in, instead of like you are telling them one thing and then doing something different. So I think leadership is hard because you had to walk that talk, but it's also very simple. Like you said with Simon Sinek, if you tell your team to read, but you don't read, that's just not going to
Mhm.
work. So obviously, leader had to be a reader, and then you had to read a lot to be able to coach your team and lead your team. That leads me to the next question is, you are really big into like technology. You are so knowledgeable. Actually, I think you give a lot of advice to people on the making up of the startup group about advices on like opening practices and the challenges, but also showing them that what's possible with your success. So share with me about the three takeaway you have as a startup. I know you've been doing it since 2020, correct?
Yes, we opened doors in June of 2020, right in the middle of COVID, which is a challenge in and of itself. Luckily, people were starting to get out in public so we could actually see one patient in the building at a time, which is all we
Mhm.
really had at the time. But a lot of other dentists ended up having backlogs once everything opened up. So we got some patients from that. Maybe reiterate the question for me one more
Yeah,
time.
absolutely. So what is the top three takeaway you have for someone that's starting their journey as a startup?
Top three takeaways for me would be one, don't be afraid. I know the first weeks, months are, there's a lot of anxiety there because there's so much unknown. And it's that not knowing what to expect that creates that anxious feeling. And if you go into it with the right heart and you're authentic, the patients are going to like you. The second thing I would say is to adopt technology. And I don't mean you have to get a cone beam right off the bat. Technology is easy as software. Like we use Flex with Open Dental, and going back to like getting really positive Google reviews, they get a message every evening. They leave the office to leave those reviews. So I think we have over 700 now in 5 years, and they're all very good reviews, 5 stars for the most part, with a few exceptions of maybe some ones. But the overwhelming amount of these reviews are paragraphs of text. A lot of them are well written, and that leads me to the next point really is have the right people on your team, because all those paragraphs are about my team members, not necessarily about me or the dentist. And they really set the tone for everything. They're the ones that drive your vision and execute your culture at the practice level. So you might have the ideas and the visions, but without the team, you're nothing. So you need the right people on the bus.
I love your three takeaways because I know I have a lot of patients listen to this podcast too. And if I'm taking your three takeaway and put it into their wellness journey, then number one, I said, don't be afraid. Listen to Dr. Pryor and say, don't
Hmm.
be afraid to enter the journey because I know it's overwhelming. It's a lot to
Yeah,
do. And you cannot do this alone. So you definitely want to research, doing your reading, doing your research, asking questions, you know, researching to make you a better, an educated patient and a better decision maker. And of course,
right.
you a great team. You cannot just have the dentist on your wellness team. You have to have a good functional integrative doctor, a good chiropractor, a good acupuncturist, any on the team that you can get to be on your side. You
Hmm.
cannot have this alone. So for us, when we
Yeah,
do, running a practice, we have to have a team. And so anyone that thinking I can do this by myself, I can self-medicate myself, I can self-supplement myself, I can self-guide it myself through wellness and navigate through all these questions from dental to medical. This is a really good reminder that you need a team and don't be
yeah,
scared.
100%. And maybe another thing I'll add, because some of these things are just kind of blending from one to the other, but for something very practical I notice in startups is that people pay so much attention to people that are lecturing and the influencers out there talking about overhead percentages, need to be this, need to be that. That doesn't work for startup or high growth office, right? So if your staff costs are 30%, not 25%, don't stretch yourself out. My main point with this one, though, is too many people are not spending enough money on marketing. And especially as a startup, you need to pay to get your message out there, your brand out there, and it needs to look good. So custom content is a huge part of that too. Having a nice website. You cannot have a cookie cutter a website with like stock images, things like that. You can't look like everybody else. You have
Yep.
to stick out from the crowd ultimately. And going back into the team thing a little bit, one thing we did with starting up that I think is hugely beneficial is I partnered with a nonprofit organization here locally that partners and helps sex trafficking survivors here locally. So we've been donating monthly to them $5 on behalf of every new patient up to this point. Just from that alone, over $18,000 have gone to them. We do hygiene drives for them. And we also just give on occasion when they're having their annual events and things like that. So for their previous in October 10th year anniversary event, we were there. They named a corporate giving award after our practice, and I was able to bring my team there. And so they got to be a part of that and see what we were doing beyond the practice. So having them involved in that process also helps them realize this is not just a job. You're not here just to clock in and clock out. We're here to empower and impact the people of the community, whether it's in the dental chair or outside.
I love that. And if someone follow you on social or looking at what you're doing and what you're building, they'd be like, man, how do you have time for your family and your own personal health? And have the honor to meet your wife and your beautiful children. I know you have done a lot of with them experiences traveling. And you know what? I love that you actually like prioritize it. So share with me a bit about that startup life in the last, 5 years from the startup practice in June of 2020 to now to this, beautiful practice with expansions and building wellness. How is that also impacting you in fatherhood, which is so important in your life?
Well, it hasn't always been easy, to be honest. I mean, there's definitely moments where I don't really believe in true 50-50 balance almost ever, right? So there's been some times when the practice demands so much more for me that I'm somewhat taken away from the family side of it. And then I kind of get back to that balance. And then times like now, where we're going through high growth and expansion again, kind of pulls me away and consumes me a little bit. So I really have to be intentional about exercise, workout routine, and things like that. I know what I'm doing. I've been working out for like my entire life since I started playing sports early in high school and all the way throughout. So it's not a question of do I know what to do, but I pay a trainer because of the accountability. I know if I'm paying him, I'm going to show up, right? And I do that at least twice a week and try to get into the gym on my own on some other days. And am I always consistent? No, but I do know that when I do it, my days are way better and I'm way more productive when I do it. And then I sleep better. So if I can develop a little more consistency on the other side of this expansion, I think things will be really nice for me personally. But to get into the family a little bit, I did mention how I live a very modest lifestyle, but I do travel a lot. And a lot of people around us will joke, oh, where are you going this weekend? You're always out of town, this and that. To be honest, a lot of mine is still CE trips. I just happen to take my family and make a weekend or a long weekend out of it with them and let them see the places that I'm going to. And that's more honestly an investment for my kids and their experiences and memories than it is something for myself. Cause that's probably peak joy for me is when I see my kids having so much fun and experiencing new things.
Yeah, I do. I remember now that you were saying that I met them on these CE trip and then
Hmm.
the work trip. And, loving the way you designed it because that's called stacking, right? In biohacking, we call biostacking. And then in,
Hmm.
high performance, like you actually combine trips together because you're going to be there anyway. So why not taking your family and spend time with them? So I love that.
Yeah.
So again, you can take CE, you can travel, but you can also do that with your family and build a trip before or after that time.
Yeah. I will say too, I mean, just to be as vulnerable as I can, there's been some moments in the past where I did get burnt out from the startup and all the stress from business and clinical and all of that. And there were times that I felt really guilty when I was just at home, wiped out, feeling exhausted, tired, that my kid would maybe ask me to go do something, play something for a little bit. And I would be like, "Ah, I can't. I just kind of decided to stop saying no to stuff like that because they're only little for so long. So Last night I was like really exhausted on the couch, like right about to pass out, and he wanted me to go play Fortnite. I was like, okay, fine, let's go for a little bit.
Yes,
And
yes,
it's
I
just
love that.
for them it doesn't take much time. They just want you to say yes and be with them for a short a period of time. And then I watched a movie with my daughter and went to bed. So
Yeah. That's quality of time. I think quality time is one of my top priority. Even if I have 5, 10 minutes with each kid, either right
mhm.
before bed or, between dinner and bedtime, for me, that's like everyday richness. I'm counting that as like, people counting money in the bank. I'm like, no, I'm
Yeah,
counting that everyday richness. And you're right. It's really humble us and remind us what we're doing and who we're doing this for.
I think
Because
a lot of people as well, kids and adults, we kind of get caught up in the phones and the technology all the time. I mean, I'm guilty of it, but Uh, when I have taken the time, my daughter's 13, she's a teenager, so she is on the phone a lot with her friends and things, right? Sometimes out of the blue, just asking them what's going on at school or like, and sometimes they'll just start talking and they'll talk for a while, and you'll just start to like really be interested in what they're saying. It will kind of open your eyes a little bit. And something that has been interesting for me from just like a very science and math background, A plus B equals C. My daughter is the complete opposite. She's creative. She's left-handed, very into music and art and things like that. So we went to a musical at one point, and before that, we had seen, I think during COVID, it was Hamilton on Disney Plus. And I would have never thought this, but now I'm like really into going to theater and musicals, So she's kind of opened up a new interest for me. That's something we share together. We just had a New York trip to go see Chapel Roan concert, which is somebody that's popular now, Pink Pony Club. I just kind of go all in. So if they're passionate about something, I just dive into it with them and make the most of it.
And Brandon, I think that make you such a great provider, clinicians, leader because you are in with people, with patients, with your associate, with your team. And that's why they respect you so much because you're not half anything. You be like, I'm all in, I'm doing this. I'm not sure I'm liking this, but I'm gonna do it. That's commitment. I think that show in your leadership, in your business, and in your family life. So give our audience, I'm asking every single guest on our podcast, what is your top 3 wellness practices? Go.
My personal top three wellness practices that I'm not always good at, but I do strive for. First would be the physical fitness and staying on track with that just because of the differences it makes for my clear mind, my day. As a business owner and a father, I don't have a lot of alone time. So my alone time's in the car or at the gym or in the shower, which is maybe the second part actually, because that's where I kind of do my silent time. I'll turn the lights off, be in the shower, and somewhat kind of meditate. And I actually come up with a lot of my ideas there or while I'm trying to fall asleep in bed. But so, yeah, the first one being the physical fitness, the second one being personal space and time to be alone, which is extremely rare for people like us, but extremely important. The third one for me, not so good at this, but staying hydrated. I see a big difference when I do drink water, which is the simplest of things. But sometimes for people like me who don't really get thirsty throughout the day, it's easy to forget. So I'm always bringing a bottle of water. There are some days where I'm busy and I leave the office and realize that I haven't even opened it yet. This one I've got like maybe I don't know, 3/4 of it down. It is alkaline, by the way, too, 9.5 plus pH. So those are probably my three right now. Maybe some other ones I'll throw in are sauna. I do love the sauna and sleep or ring. It's been huge. I
Yes.
love seeing consistent nights and that streak I get when things are going well. So I can see when things I'm doing are affecting my sleep and why I might feel not so good the next day, a little bit groggy, things like that.
And I know that when providers are really tap into their wellness, the conversation with patients is a lot natural and easier. Like whenever I see a patient that wearing the ring, I'm like, "How's your sleep? Like, show me on your phone." And so the
Mhm.
the the conversation is almost like you understand what they're going through. They tracking, they value their sleep, they value their wellness, and then they're willing to invest in the time and remind themselves that, hey, yes, I have a tough day yesterday, but I'm going to do better today. I'm going to sleep more today. I'm going to make more movement today. I'm going to get my steps
Yeah,
in. So I think wellness is going basically now and just being the best version of yourself, the way that
that's
you
pretty
want.
much
If
it.
people thinking like there's a box and you have to fit into that box, or you have to do this to be a wellness dentist. You have to do this to follow wellness. And to me, that
Yeah,
just stressed me out to feel like I have to stuff everything in the box because we don't treat patients like
exactly.
that, right? You treat everyone's like a unique individual.
Well, some people treat patients like that, and that's the problem. And we're trying to overcome that. Yeah, and for me, it's been kind of eye-opening to go through the Oura Ring, just to go back a little bit. The software gets smarter and smarter, right? There's AI built in now. And so if it realizes I'm not doing so well that day, I didn't have a great night of sleep, it'll give me these recommendations. And if I follow those recommendations, I actually get back on track. So it's kind of interesting to see the development of AI and where that's going and how that's going to make our jobs easier and better and make outcomes better for our patients. And I'm really excited for the future, honestly.
Yeah, you just mentioned something that I know everyone want to hear more about. So I'm going to ask one more question about that. You're big on technology. You are so good at like, I'm going to try, I'm going to take risks because I'm curious and I know it's great things coming from it. What are you seeing AI for dentists, especially wellness dentists like us, is what is going to help us in terms of treating patients, efficiency, time and also knowledge because there's so much out there. What is AI is going to have a place in a practice like our practice? What do you see that where we're going with AI?
I can tell you my ideal maybe for it, and I don't know how long this would be out, but I mean, obviously we have all the digital scanners to get scans of the teeth. We have these extraoral scanners to scan the face. We have the cone beams with things like DiagnoCat that can read the cone beam and see things better than any of us can. But you could probably have it read also your medical and dental history and all the 2D images as well, symptoms, problems, anything the patient has. It could probably basically give you just a treatment plan at that point with a full diagnosis. That's probably where it's going to end up at some point. But right now, just leveraging things like AI to chat about some challenging cases. These chronic illness patients are very tough to work with because they see so many doctors. They get blood work over here, this over there. There's so many things going on. So I try to source as much of the information I can. And you can't just plug it in and have AI tell you the answer right now. You still have to have a knowledge base, but I use it as more of like brainstorming. It's like me talking to myself and getting an expert talking back to me in a way. Now, is it always 100% correct right now? No, it's not. So you do have to still be a clinician. But ultimately, that's what I'm really excited about is how more and more the knowledge base is expanding. It's getting better with answers. And I haven't fully adopted DiagnoCat yet, but I did like the demo that I saw. I think early 26, I'm probably going to end up pulling that in. I think even down to the level of caries, it was seeing some things. So it's pretty interesting. You might have one image to see everything.
I know, and I know the person going to benefit out of this will be the patient because how we organize data, right? Because before, just like you said, a piece of data over here, a piece of data over there, and it kind of just scatter between different providers. And now
Hmm.
we can really centralize it to for the patient benefit. Communication between providers are better and you actually can tap into that file and really have a big pictures about what the patient going through and elevate us role as a dentist on the team of the medical team, not only the person that just look at teeth, but we actually can give the medical provider a lot of insight what we see in the mouth and help them with the whole body approach and treatments. I'm actually super excited
Yeah.
for the future. I know different camp of AI like worry about all of this thing that AI is going to replace, but I think AI is going to complement. I'm actually looking forward to implement more and more AI in our day-to-day and patient care. The
Yeah.
person benefit is definitely patients to get better care, and then we are better provider with the right information and the complete information in front of us.
And I think another big factor is the efficiency that it allows us, right? Recently, what I've been looking into and kind of playing with is we use Mango for voice recording the calls that come in and go out. And instead of like trying to read it or listen to it and train myself, like I'm not even an expert on phone calls, but we have an AI platform that you can upload this audio file to, and then a couple of minutes it spits out like a grade for you. It gives you recommendations on training and things like that. You can do the same with recording your consultations, make you a more effective at your cosmetic or functional consults and how you can relate to the patients better. I mean, ultimately, it's just saving so much time for me right now. I don't know that I'd be doing as much as I am now without AI. And most people around me, I continue to tell you, you are underutilizing this very
Wow.
severely.
Yeah.
And then my daughter and my wife and some other people are just joking that I'm gonna get married to ChatGPT, but
And remember people said that they actually using AI and ChatGPT a lot for therapy, right? For conversational. And to me, just like journaling, if you are journaling and you put your thought out there that your brain dump, we talk about like, hey, let's get all that thought out twice a day.
yeah,
So it doesn't like going in there and disrupting us. Why not put it into something like course protected information?
yeah.
Put it on there and have a conversation with yourself. I think it's amazing. It give you some clarity. The conversation bring clarity.
Yeah, that's pretty much it, and it's very funny how, like, nice it is in its responses. It's like, really great thought, very smart way to think about this. Let's expand on this. Would you like me to do this next? I
Yeah.
never thought about that. Yeah, let's go ahead and do that.
I actually want to kind of like pick into your conversation with your own AI one day because I think it's like Brendan talking to Brendan. It's going to be so cool.
Yeah, can't wait for that.
But great conversation today, Brendan. I know your time is so valuable. So if people that listen, I know we have patients, we have providers, we have dentists listen to this podcast. Where do they stay connected with you if they have more questions or follow your journey? Because I know great things are coming for you.
The two best ways to reach out to me or follow me would be Instagram at Dr. Brandon Pryor, Pryor, Prior. There's no Y. Or my email. You can send me an email because I'm on there multiple times a day, priordmd@gmail.com.
You hear that, make sure you follow Dr. Pryor's and then cheering him on. And I know great things are coming for him. I'm so excited. I know I cannot say a lot of things right now because I know things are coming for him and his big things are coming. So please stay tuned. And I'm definitely going to have Dr. Pryor's coming back to give us an update on more wellness and more expansions and more great things for him and his team and his patient. And so reach out, stay tuned, and subscribe. And we'll see you guys at the next episode. Bye.
It's good. Thanks. See you guys.
Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.